Hi everyone, my name is Ahil Tendril, and my presentation is on understanding the causes of Lyme disease, the symptoms of Lyme disease, and prevention methods for Lyme disease. So I'm going to first talk about the significance of this, the research rationale, and what search procedures are used. So Lyme disease is the most prevalent vector-borne illness in North America and Europe, making it a critical topic for public health research. The decision to investigate Lyme disease stems from its increasing incidence and serious health complications it can cause if it's left untreated. The disease's impact on various populations, especially those frequently exposed to tick habitats, underscores the importance of understanding its transmission, symptoms, and prevention. The research process involves a comprehensive review of peer-reviewed journals, data from Centers for Disease Control and Prevention, or otherwise known as CDC, the World Health Organization, or WHO, and recent epidemiological studies. These sources provide a robust foundation for analyzing the scope of the disease, identifying affected demographics, and evaluating current treatment and prevention strategies. Lyme disease is a growing public health concern, particularly in regions with high tick populations. The significance of this topic lies in its increased incidence and potential for serious long-term complications if left untreated. The decision to research Lyme disease stems from its greater prevalence and greater need for public awareness and understanding of its causes, symptoms, and prevention strategies. The research process involves a comprehensive literature review using reputable resources such as Centers for Disease Control and Prevention, otherwise known as CDC, the World Health Organization, or WHO, and peer-reviewed medical journals. This approach ensured that the information gathered was accurate, current, and relevant to the scope of the presentation. The search procedures used for this research included querying databases such as PubMed, Google Scholar, and official health organization websites. Keywords used included Lyme disease, Borrelia burgdorferi, tick-borne illness, Lyme prevention, and Lyme treatment. Filters were applied to prioritize recent publications and studies conducted in North America and Europe, where Lyme disease is most prevalent. This research also included epidemiological data, clinical guidelines, and public health reports to provide a well-rounded understanding of this disease. This approach allowed for collection of diverse perspectives and data points contributing to a comprehensive analysis of Lyme disease. So now I'm going to talk about who is the problem, how big is the problem, who is affected, what is the outcome, what are the causes, what are the preventive measures, what can be done to prevent, treat, and help the problem. So Lyme disease primarily affects people who spend a lot of time outdoors in grassy or wooded areas where ticks are prevalent. This includes hikers, campers, hunters, and residents of rural or suburban regions. Children and outdoor workers are particularly vulnerable due to their increased exposure to tick habitats. Pets, especially dogs, can also be affected and may inadvertently bring ticks into the home, increasing the risk for family members. Understanding who is at risk is crucial for targeting prevention efforts and raising awareness among high-risk populations. Lyme disease is the most common vector-borne illness in the United States, with approximately 30,000 cases reported annually. However, due to underreporting and misdiagnosis, the actual number of cases may be significantly higher. The disease is also prevalent in parts of Europe and Asia, making it a global health concern. The increasing incidence is attributed to factors such as climate change, which expands tick habitats, and growing deer populations that serve as hosts for ticks. The widespread nature of Lyme disease underscores the need for effective surveillance, public education, and preventive measures. Lyme disease can infect anyone exposed to tick-infested environments, but certain groups are more susceptible. These include outdoor enthusiasts, rural residents, children, and individuals with occupations that require time spent in nature, such as forestry workers and park rangers. Pets, particularly dogs, are at risk and can act as carriers of ticks into domestic spaces. The disease does not discriminate by age or gender, making it essential for all individuals in endemic areas to be aware of the risk and take appropriate precautions. If left untreated, Lyme disease can lead to severe health complications, including chronic joint inflammation, neurological disorders such as facial palsy and memory issues, and heart rhythm irregularities. Early symptoms include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. Prompt diagnosis and treatment with antibiotics are crucial to prevent progression to more serious conditions. The long-term outcomes can be debilitating, emphasizing the importance of early intervention and public awareness. Lyme disease is caused by the bacterium Borrelia burgdorferi, which is transmitted to humans through the bite of infected black-legged ticks, also known as deer ticks. The transmission typically occurs when a tick remains attached to the skin for 36 to 48 hours. Environmental factors such as climate change, deforestation, and urban expansion into natural habitats have contributed to the spread of ticks and increased human exposure. Understanding the biological and ecological causes of Lyme disease is essential for developing effective prevention methods and control strategies. Preventive measures for Lyme disease include using insect repellents containing DEET, wearing long sleeves and pants when in wooded or grassy areas, and performing thorough tick checks after outdoor activities. Prompt removal of ticks can significantly reduce the risk of infection. Public education campaigns are vital to inform communities about these practices. Additionally, landscaping techniques such as clearing brush and maintaining short grass can help reduce tick habitats around homes. These measures collectively contribute to lowering the incidence of Lyme disease. To prevent and treat Lyme disease effectively, early diagnosis and administration of antibiotics are essential. Public health initiatives should focus on tick control programs, development of vaccines, and widespread education on prevention strategies. Research into improved diagnostic tools and treatment options is ongoing and necessary to address the complexities of the disease. Community engagement and collaboration among healthcare providers, researchers, and policymakers are key to mitigating the impact of Lyme disease. The key takeaway from this presentation is that Lyme disease is a preventable and treatable condition. Awareness and education are critical in reducing the incidence and ensuring early intervention. Individuals must be proactive in protecting themselves and their families, especially in high-risk areas. Public health systems must prioritize Lyme disease in their surveillance and prevention efforts to curb its growing impact. Additional factors influencing the spread of Lyme disease include climate change, which can expand tick habitats, and increase deer populations that serve as hosts for ticks. Pets can also play a role in bringing ticks into homes, thereby increasing exposure risk. These insights highlight the multifaceted nature of Lyme disease and the importance of a holistic approach to prevention and control. So now I'll go over the important findings and implications and suggestions for future research. Lyme disease is a growing public health threat with significant implications for affected individuals and communities. The research highlights the need for improved diagnostic tools, effective treatment protocols, and robust prevention strategies. Public health policies must prioritize Lyme disease through enhanced surveillance, education, and research funding. The findings underscore the importance of early detection and community awareness in managing the disease. Further research is needed to develop more accurate and rapid diagnostic tests, explore vaccine options, and understand the long-term effects of Lyme disease. Studies on tick ecology and the impact of environmental changes on disease transmission can inform prevention strategies. Collaborative efforts among researchers, healthcare providers, and public health officials are essential to advance knowledge and improve outcomes for individuals affected by Lyme disease. These are the references I used for my presentation. Thank you for listening to my presentation. I really appreciate it.